Can achondroplasia be cured? Hi. Achondroplasia is a genetic disorder that causes dwarfism, occurring in about 1 in 40,000 births. Achondroplasia arises due to mutations in the fibroblast growth factor receptor 3 gene, abbreviated as FGFR3, which disrupts normal bone growth and development, especially in the limbs. Causes of achondroplasia. Achondroplasia is mainly caused by spontaneous mutations in the FGFR3 gene. While most cases occur sporadically at a rate of 1/40,000 as mentioned above, in up to 50% of cases, parents with achondroplasia are likely to pass on the mutated gene to their children. Symptoms of achondroplasia. A person with achondroplasia may exhibit more or less of the many symptoms listed below. 1. Short limbs. Arms and legs are shorter than normal people. The upper arms and thighs are more severely shortened than the forearms and lower legs. 2. Big head. People with achondroplasia often have larger heads, characterized by a prominent forehead and flattened nose bridge. 3. Dental problems. People with achondroplasia may also have crowded or misaligned teeth. 4. Excessive or abnormal curvature of the lower spine. The lower spine of a person with achondroplasia can curve inwards so much that it causes a condition called lordosis, which can lead to kyphosis. The child may also develop a small hump near the shoulder that usually disappears once the child begins to walk. 5. Spinal cord compression. Because there is a disproportionate development between the spinal cord and the spinal column due to small vertebral canals, it can lead to a situation where the spinal cord is compressed in adolescence. 6. The lower leg is bent, the foot is deformed. The lower legs may appear bowed. The feet may be short and wide with flat arches, or flat feet. 7. Trident hand. The space between the middle finger and ring finger is unusual, creating a distinctive trident-shaped hand. 8. Muscle tone and joint flexibility decrease. Poor muscle tone and loose joints are common characteristics of people with achondroplasia. 9. Ear infection. People with achondroplasia also often have middle ear infections and are susceptible to hearing loss. And 10. Development is always below normal developmental milestones. Children with achondroplasia often have developmental milestones, such as the ability to walk, that may occur later than usual, usually between 18 and 24 months instead of about 12 months. Of course, it's important to note that some symptoms of achondroplasia can also resemble symptoms of other conditions. Therefore, to know for sure, you need to see a doctor for a comprehensive evaluation and accurate diagnosis. Diagnosis of achondroplasia. Achondroplasia is usually diagnosed soon after birth through a physical exam and X-rays. Prenatal diagnosis through genetic testing is also feasible for families concerned about fetal development. Can achondroplasia be cured? How can the disease be treated and prevented? Unfortunately, there is currently no medical cure for cartilage and bone dysplasia. However, management strategies that focus on improving quality of life and addressing related health problems can also help improve the patient's health status and quality of life. 1. Regular medical monitoring. People with achondroplasia need to be monitored regularly by healthcare professionals to detect complications such as spinal deformities and breathing problems. 2. Physical therapy. Physical therapy exercises, yoga therapy, and acupressure massage also have a very good effect in opening up the meridians, actively stimulating the nervous system, and enhancing joint flexibility, muscle strength as well as overall mobility. 3. Surgical intervention. In necessary cases, people with severe achondroplasia may require surgery to relieve spinal compression or correct limb abnormalities. 4. Psychosocial support. It is also very easy to understand that people with osteochondrodysplasia and their families need a lot of support in terms of spiritual life, emotional support in social relationships, to help the patient and his family. And 5. Genetic counseling. This is a very delicate but very necessary issue. Assist young couples who are at a high risk of carrying the FGFR3 mutation in understanding how the disease is passed from parents to children. Provide guidance on family planning options, prenatal diagnosis, and genetic testing, including pre-implantation embryo screening. And, in many cases, we should even consider the option of donor conception or adoption instead of natural birth, etc. In short, achondroplasia poses countless challenges for individuals as well as for medicine. However, proactive measures in understanding its genetic basis and prevention strategies offer avenues to minimize its impact. By leveraging genetic counseling, prenatal diagnosis, and assisted reproductive technologies, individuals and families can make informed choices to prevent the transmission of achondroplasia to the next generation. Wish you health. Thank you. Goodbye and see you again.